Hi, I'm Colette Acker, and this is Janice McPhalen, and we are IBCLCs from the Breastfeeding Resource Center in Pennsylvania. And today's topic is
Engorgement.
Ooh. While it doesn't happen to everyone, the women who experience this, it can be no fun. So, Janice, why don't you tell us what engorgement is?
I'd be happy to. So engorgement, it typically occurs in the first week after the baby's born. So you have this surge in milk production, and not only that, you have swelling in the area due to water retention. You might spike a fever from all of this going on in your body, and moms are in pain, the breasts are hot, the skin actually feels taut, and because of all of this, your baby might be having trouble latching on. The good news is this only lasts for like 24 to 48 hours, so hang in there if you're in the midst of it. So, Colette, what should we do about this?
Well, as you just heard, the problem can be twofold. So we have a breast issue and possibly a latching issue too. So first, let's talk about the breast. What we want to do is reduce the swelling and get some of that extra milk out. My first go-to is Maya Bowman's therapeutic breast massage. And basically, we typically instinctually want to push this way to get milk out. Push the breast this way and massage that way. But this technique actually works the opposite way. You want to go from the base of the nipple back to the chest wall. So moms can do some gentle massage that way. That helps with lymph drainage and reduction of the swelling. They could also massage around the base of the nipple, do a little hand massage or hand expression, go around a little farther back, do a little hand expression. All this will soften the breast tissue. So moms who do this a few times a day during this period actually have a lot less pain and their breasts feel more comfortable sooner.
Great. So that's what you do right before a feeding. So let's talk about in between feedings to kind of take the edge off. So cool compresses can help reduce swelling. Remember, we're talking about a lot of swelling in the area. So put your cool compresses on, maybe 20 minutes on, 20 minutes off. And you could use an ice pack, you could use a bag of peas, anything that kind of conforms to the breast. The old standby is cold cabbage leaves. You want to take your cabbage, make sure you wash it before you put it on your body, and like kind of crunch up the cabbage, and then it will sort of like form to your breast.
Right, and right before feedings, you want to place maybe some warm compresses, do a little bit more massage to help the milk flow. So the swelling kind of stops the milk from flowing, so we reduce the swelling and then give the breast a little help with the milk flow also. So those are great tips for the breast, Janice, but what do we do if a baby's not latching?
Good question, Colette. I mean, it's not only the breasts that are hard and swollen, but that areola around your nipple, that can also get hard and swollen as well. And it makes it difficult for some babies to latch on. They might be latching great for the first 3 days after they're born, everything's going well, and then the breast gets hard and swollen, and suddenly the baby can't latch. I mean, it's like latching onto a bowling ball.
Yeah. Not very easy.
Right, and so there's a few things you can try. The first we call reverse pressure softening. So you take a breast, you put your fingers on either side of the breast, and on either side of the nipple, and press and hold. So hold for about 30 seconds maybe, and then you can rotate your fingers to the other sides and then press and hold again.
And remind moms to press towards the chest wall. People are often squeezing their nipple. We're going back towards the chest wall.
Yeah, right. Sometimes you'll even just see an indentation of a finger right in the edema of the breast. So, that's how swollen some of these poor mothers are. So,
that really softens this area so the baby can latch on, though.
And you might see some milk come out at this point, and don't worry about that. That's okay too. Another thing you can try is hand expression that we had talked about a little bit before, and you can use a combination of these two methods. Some cases a mom might use a nipple shield to get the baby on. If that nipple really almost disappears when the breasts are so hard and taut, in these cases a nipple shield can be helpful. So,
hey, wait a minute, I just had an idea.
What?
I think our next video should be on hand expression.
Oh, that's a great idea.
Right.
We need some volunteers or one.
Some
volunteer.
models,
Yeah.
just one. If anybody's interested, let us know.
Yes. One other thing I thought of as well is that some moms choose to pump, and this is okay. You could pump to relieve some of the milk, but it's really a lot of extra work. You got to pull your pump out. You might not even know how to use it yet. You got to wash everything. So it's not like the handiest thing to do. And in addition to that, if you take out too much milk with the pump, you might cause an overproduction. And so, that's not a good thing either. That's not going to help our problem of engorgement.
No. The one pump I do recommend at times is the Haka pump.
Oh, that's a good idea.
Yeah. So this pump, you nurse the baby on one side and then you put the Haka on the other. You have to get it to create a suction or a vacuum. So you squeeze it, you put the nipple in, and you let go, and it holds on all by itself. Or you can bend the Haka back, put it over the nipple, and have it suck in like that. So this works great because it doesn't just collect the drippings or the drippings like Thanksgiving dinner, but it creates that vacuum so you get a little bit more, but it's not going to drain the whole breast and cause a mass overproduction, and will really help the mom to feel comfortable over the 2 days that this is occurring.
Colette, I just thought about something. How about those moms that have swollen accessory breast tissue?
Yeah, that's really uncomfortable.
It's like when you have, do you have like a lump in your armpit? It almost like hurts to put your arm down. This is what we call accessory breast tissue. Look, we're mammals. Our milk line starts about here. It comes down. It runs all the way down to our legs. And so you can have breast tissue anywhere along that line. So sometimes this tissue, it's not connected to the nipple. I mean, you could massage it and push it towards the nipple until the cows come home, and you're still not going to get milk out. So the best thing to do for this is apply cool compresses. Just treat it like any other swelling. Keep cool on there as much as possible until the milk basically stops producing and dries up. And the cool compresses can help give you some relief.
Yeah. And the final thing is to talk to your doctor about a pain reliever. So usually something like ibuprofen works because it not only relieves pain and possibly those symptoms of a fever, but also it's an anti-inflammatory, and that's just what we need right now. So are there things moms can do to prevent this? If there's any pregnant moms out there watching?
There are. The best thing you can do is nurse your baby frequently. Put the baby on early, after delivery, and often. And make sure you have a good latch as well so the breast is getting drained properly. If you miss a feeding, express your milk. That's really important. But look, you can do everything right and you followed our techniques and you still end up with this painful problem. That's okay. Just hang in there, because remember, it only is a day or two before this problem starts to resolve. So hang in there.
Hang in there. It's a long day or two, but it will go away. So that's about it for engorgement. And if you have any other topics that you'd like us to discuss, just let us know. Thanks so much for joining us. And remember,
the BRC is a nonprofit organization dedicated to providing expert clinical and educational services. Until next time, I'm Janice McPhailin.
And I'm Colette Acker. Thanks for joining us, and have a great day.